Yes. How are you including people with a learning disability in your work?
Well, it's really important to me, and I think to everyone at Mencap, that we're a charity that is genuinely led by people who have a learning disability themselves. So everything that we try to do at an individual level, where we provide direct services to people, or at a community or a societal level, we try to make sure that everything is personalised, co-produced, which means developed in partnership with people with a learning disability, and all of our priorities and where we spend our money should be determined by the views and the needs and the dreams of people who have a learning disability. So as you know, Vijay, we've made some changes in the last year, including recruiting colleagues who have a learning disability onto our leadership team, and you're one of those colleagues. We've also strengthened the role of the Voices Council and involved people who have a learning disability in our governance review. And all of our campaigning efforts are led by people with a learning disability, including the work that we did last year when we campaigned to ensure that people who had a learning disability were on the priority list for the COVID vaccine. And even today, as we continue to campaign on the closure of the long stay hospitals, we're supporting families and other self-advocacy groups to ensure that their voices are heard. So I think we should make sure that people with a learning disability are always in the driving seat in determining the priorities that we have in our strategy, in our big plan. And we will continue to support, I've called them our army of inclusion consultants who play such a key role at Mencap.
Okay. How should society do the same?
Well, if we reflect on the last year, which of course is what an annual report is all about, it's been a good year for raising awareness of learning disability, I think more broadly in society, with things like our very successful Mythbuster campaign. And we've seen lots of people with a learning disability being far more visible in the mainstream media. And of course, the more the general public are aware of what a learning disability is, and the more people in society come into contact with someone who has a learning disability, the more inclusive society should become. So we'll need to just continue to do what we do and support people with a learning disability to be far more visible in society, and I hope things will change for the better.
Why is our big plan exciting?
Well, I think our big plan is really ambitious and visionary. And, you know, we want the UK to be the best place in the world to live a happy and healthy life if you have a learning disability. And to help us achieve that vision, and we won't do it on our own, we have to work in partnership with others, then we have to change as a charity. So Mencap is changing. I think we've already talked a little bit about putting people with a learning disability in the driving seat, but there are other changes happening too as a result of our new big plan. So we want to work far more in local communities, supporting people and their communities to develop their own capabilities. So that's a really important part of the big plan. We want to be known for all the leading research that we do. We want to be known for working far more in partnership with other people. And we want to be known for providing specialist support and advice to people with a learning disability and their families, and for being a great employer. And because of COVID, some of our ambitious plans, quite understandably, have been delayed. But despite the pandemic, I think we've really achieved so much this year.
Yeah. So that was going to be my next question. What are we achieving? But I think you covered that.
Well, I can say a few more things if you want.
Yes, feel free to add it. Yeah.
Okay. So in terms of our major achievements this year, we've supported, over 5,000 people who live in England and Wales and Northern Ireland. And we have successfully campaigned on some really important and quite serious issues. We've provided thousands and thousands of hours of advice and support to many people and their families. We've carried out some really important pieces of research. We've launched the annual Big Learning Disability Survey, which I think we're all really excited about. We've supported learners into work. We've operated our 42 shops despite the challenges that are presented or were presented by the pandemic that impacted on retail. And we had one of our most successful fundraising years of all time, generous donations that we will use wisely to achieve our vision.
Okay. And how do you want the future to look for people with a learning disability?
Well, we've covered some of this already in the interview, but people with a learning disability have told us what's important to them. And so Mencap is focusing its resources on a few particular areas, the ones that are most important to people with a learning disability. And obviously all of this is about making the future a much better place. So health inequality in particular is one of the priority areas in our big plan, and in particular the issues that are emerging around mental health and well-being, which are really concerning. We're also looking at social care reform, very much thinking about the future, and we are looking at work because people with a learning disability tell us that they'd like to work, and we know that the number of people who are in jobs is very low compared to their non-disabled peers. And the closure of the long-stay hospitals is also one of our priority areas. We're also looking at what's happening right now as we're doing this interview with the cost of living crisis and how that's having a detrimental impact on the lives of people with a learning disability. So I think when I look to the future, I think, wouldn't it be wonderful if the health inequalities were removed and that people with a learning disability had the same life expectancy as everyone else? Wouldn't it be great if everyone who needed social care support had a very personalised package of support that they didn't have to contribute towards the costs of, and one that really met their needs? And wouldn't it be great if everyone who wanted to work had the opportunity not only to get a job, but to have a really rewarding career? And wouldn't it be great if in the near future no one would ever find themselves locked away in an assessment and treatment unit miles away from their family and friends? That's what I'd like the future to look like.
What's the best thing that's happened this year?
Gosh, I think it's really difficult to choose just one thing, but if I was forced to choose something, I'd say the Oliver McGowan mandatory training for NHS colleagues in England, the training being included in the Health and Care Act, and the UK government accepting the amendment, which went beyond the government's initial commitment by implementing a code of practice to guide the training. I think that's an amazing step forward, and Oliver's mum and dad should be really proud of all the campaigning they've done, and we're really proud that we've supported them and achieved such a great thing.
And vice versa?
Well, one of the biggest challenges that we've had this year at Mencap has been the recruitment and retention, particularly of support workers. Despite all of our efforts and the efforts of those who are working in the social care sector, unfortunately, working in social care is still not seen as a valued profession in society. And yet we know what our amazing support workers do every day, and they delivered care and support to thousands of people. They worked so hard during the pandemic in really difficult circumstances, and many of them are suffering now from COVID burnout. So I was pleased that quite recently Mencap was able to offer a better pay and reward package, but I don't think it's still not really enough in my view. So we will continue to campaign so that there's proper funding in the social care sector, and we'll keep campaigning so our government and society recognise what a highly skilled role providing social care support is.
Okay. Why do you work for Mencap?
I really love my job. I feel very lucky that I'm the CEO of Mencap, and I hope that I'm doing a good job and making a positive difference. Mencap's an organisation that shares my personal values, and because I've spent all of my working life on matters to do with social justice and trying to address inequality in society, when the role at Mencap came up, it felt like a really good fit for me. And I really love working alongside passionate and caring people like you, Vijay.
Oh, thank you. Do you have a message to everyone who works for Mencap?
Yeah, I'd like to say a really big thank you to everyone who works or volunteers at Mencap. You should be very proud of what you've achieved this year. And although we've faced quite a few challenges and we haven't always got things right, there is a real desire in the organisation to learn and to improve, which I think is all we can ask of each other. And I sometimes wish there was another way of saying thank you, but it's a big, huge thank you from me to everyone who works at Mencap for their hard work and their commitment and their passion over the last 12 months.
Okay. And the last question, is there anything else you want to say?
Well, I'd like to say thank you to you, Vijay. I've really enjoyed our conversation, and I'm keen to hear what people think when they experience the new way of Mencap presenting the annual report. Be great to get people's feedback when they see these videos. I also hope that people with a learning disability and their families, our network partners and other key partners, our funders, our supporters and other stakeholders, I hope you all really enjoy reading and watching our 2022 annual report. We're very proud of what we've achieved this year, and I hope all of you will continue to support us to achieve our vision. Thank you.